us. I guess that they will join us at whenever they will join us. So good evening to everybody. I'm very, very happy to be here. I'll introduce myself because I'm seeing most of you that I'm not familiar with. So those of you who this is their first time, I'm just going to introduce myself. My name is Dan Kaufmann. I'm a research assistant professor here at University of Utah, Department of Neurology. And here in the headache school, what we're doing is that every fourth week of the month, we're giving this workshop, which we call Tools and Techniques for Working with Migraine. And those of you that this is their first time, again, every month we're doing that. The purpose of this workshop every fourth week of the month is to do a little less talking and more kind of hands-on practice, not because we feel that information is not valuable, but just because we want to give the headache school participants really kind of tools that they could really, just take and use them immediately after the end of the sessions and get the benefits from them. So usually what's going to happen is that we're going to have a presentation which is going to be about 10 minutes, and then we're going to do a practice, and you will have a chance to ask questions, and we'll teach you how to do the practice on your own. So I'm just going to go ahead and share my screen, and we're just going to start with just a brief introduction of what's the topic for today, what are we going to talk about, and what's the exercise that we're going to do. So I'm going to share my screen right now. Okay. Give me a thumbs up, all of you, just to make sure that everybody can see my screen. Can everybody see my screen? Give me a thumbs up. Okay, wonderful. Great. So what we're going to be talking about today and the exercise that we're going to do is involved with working with negative emotions. And again, this is part of the tools and techniques for headache management. And what I would like to start with is to ask, why is it that we even need to bother with these emotions? Like, well, what is the purpose? This is headache school, migraines. Well, why do we need to deal with emotions? And so the answer is that despite the advancement in science and in medicine, a lot of medical practitioners and healthcare providers are still very much puzzled and feel rather helpless with helping people that have migraine disorders. And also, those who have migraines or headache disorders are, needless to say, that these migraines are a very much reason for distress. And despite everything that is happening and new medications that are out there and new treatments and new therapies, up to this point, and correct me if I'm wrong, but there's no one thing that actually cures it all. There's no one medicine or one treatment or one surgery that actually can just, take away the migraines. And so what happens is that a lot of people that are suffering from migraines are currently facing reality that they have these recurrent headaches, these recurrent head pains. They feel frustrated, they feel demoralized, sometimes they feel anger. Why is it that I'm having the migraines? Why is it not going away? Some of them get depressed, some of them feeling helpless or hopeless, that I don't know when is it going to end, how am I going to live my life, and so forth and so on. So because of that, there is currently a great need to address those emotional consequences of headaches. And currently now it is known that a better treatment for people with migraine disorders is a multidisciplinary treatment composed of the medicines and medications, but also addressing the cognitive, emotional, and behavior aspects of chronic pain. And the fact is that those who are living with migraine disorders, once they're learning the effective coping strategies to deal with those underlying other aspects of migraine pain, actually those help them improve their qualities of life, despite the fact that they might still be having migraine pain. Now, this slide, I can pretty much spend several sessions just to talk about this slide because there's so much in it. But first of all, I don't want to bore you. I just want to say that when we're talking about emotions or migraine, there is an emotional aspect, first of all, to a lot of different kinds of pain, but also for migraine in particular, because as we know, the migraine pain signal, the specific signal that is getting into the brain, it doesn't only go to those areas that help us recognize that we have a certain pain in a certain area in the head and it feels electric like, or it's cold, or it's sharp, and so forth and so on, which are the more sensory components of pain. But those signals physiologically are going to other brain areas that are responsible for regulation of affect, for motor functions, for visual, auditory, and olfaction or smell processing cues, and of course, other areas that are also involved in memory and so forth and so on. So if we look at this diagram this image on the right, and of course you do not need to memorize all these different acronyms and brain areas, but just to let you know that there are many of these areas shown here in this blue and red and green. All of those brain areas, some of them are what we call the limbic system. All of those areas have been shown physiologically to contribute to the anticipation of pain, to the anxiety from pain, to being preoccupied with our bodies, and so forth and so on. So, all of these brain areas that are not necessarily connected with just the sensation of specifically of the pain, but there are involved in what we call the affect or the emotional aspects of pain or the pain unpleasantness are actually a physiological component. So addressing the emotional aspect of migraine is also, it does have a physiological basis because of all these brain areas. Now we know that migraine is also associated with other conditions such as anxiety, such as depression, and this relationship is bidirectional, meaning one affects the other. So first of all, if I have a migraine, of course I'll probably be anxious about it. It's not pleasant. But also in between attacks, I can also have an increased anxiety because I'm afraid, oh, when is the next migraine going to hit me? And those two influence one another. The occurrence of migraine might increase the stress, and it has been shown that if I'm more stressful, I might experience my migraines in a more severe way. So it also has been shown in the literature that some of the migraine triggers, one of the migraine triggers that is very prevalent is stress. That has been reported by about 59% in clinical based population studies. And stress has been shown to either initiate or exacerbate the occurrence of migraines. Furthermore, other therapeutic modalities that has been shown to address the stress component or teach people that have a migraine disorder with stress management techniques have been shown that those specific people have shown improvement with endpoints in migraine and chronic tension type headaches. And also some studies that involve the use of mindfulness, such as what we're going to do today, also has shown that it improved, it showed improvement of those people that experience migraines. So hopefully, up to this point, I was able to somewhat convince you of the link between the occurrence of migraine and emotions or affect. But let's assume that we do have emotions that we want to deal with. How do we work with emotions? So again, this is very brief, kind of a list of some ideas. There's a lot that I can discuss about each and every of these points, but I just wanted to use this to give kind of snippets of what are possible ways for us to deal with emotions. And I don't want to call emotions good or bad because I don't like those terms, good emotions, bad emotions. I do want to use the term resourceful or unresourceful because a lot of emotions can be categorized whether they're helping us or not, but every emotion actually can be learned from. So, how do we work with emotions? So, the first aspect is the fact that the emotions are the realm of the unconscious mind. A lot of our behaviors, our thoughts, and all of a sudden, if we feel certain emotions, it seems as if they're automatic and they're outside of our awareness. This is an important point because a lot of times I see a lot of some of the people that come to me to my private practice and they're trying to will themselves out of feeling a specific emotion, and they think that if they're just going to be strong enough or they're going to force something, then they won't experience that emotion. And I always choose to explain that emotions are coming from our unconscious mind and they're just appear, and trying to will ourselves out of not feeling a specific emotion usually might not be very productive. The second point I want to make is in terms of awareness. A lot of the time, especially if we have emotions that are not resourceful, we don't want to deal with them. We don't want to have them. We just want to push them aside and not have them. And that makes sense because no one wants to feel bad. However, with that in mind, it is important to first be aware and notice our emotion, notice exactly what we're feeling. And instead of pushing them away, maybe cultivate a different approach of allowing them to just be instead of pushing them away. Because from my experience, when we try to push something away or resist it, usually we might be amplifying it. Another thing is once we recognize some emotions, it's describing them in a sensory based language, such as I'm experiencing anger right now. I feel tension inside me coming and going, or I feel some pressure in my stomach, and so forth and so on. So that just describing to yourself what is it that is going on. And that a lot of time is important because these emotions are not this amorphous kind of thing that we don't know where they are, like this monster that we don't know how to deal with. When we actually give the verbiage of describing what we're feeling, it helps us know what is it that we're dealing with. Another point that I want to make is about inner parts. Now, this is something that I'm kind of wondering if some of you had this experience. Like, let's assume that you went to the mall, or I don't know, you went to some place when there's a lot of shops, and you saw some, I don't know, a watch or a purse, or guys, if you maybe a motorcycle, or I don't know, something you wanted to really you wanted to buy. And it's like all of a sudden, like you felt inside, oh, I really want to get this watch, or this pants or dress or whatever that may be, or computer. I really want to get that. I could really use that. But then as you were thinking about it, all of a sudden there's something inside you that bubble up and say, you know, yes, I do want to get it, but I'm really on a budget and I probably should not be spending money right now. And as you were thinking that, all of a sudden, you had this urge. It's like, but I haven't bought myself something like something nice for a long time. I really want to get just this once. I want to get it. No. I'm on a budget. I really shouldn't get this. So did anybody have this experience of these like two different and opposing tendencies inside yourselves? Usually when that happens, and it could be with other examples as well, we used to say that it's because it's like we have these inner parts inside ourselves. It's like we have these tendencies. And again, this is something that is completely normal. And we just want to be aware of these tendencies inside ourselves. Now, why am I explaining all of that regarding emotions? Because a lot of times it is useful, instead of saying, I am sad or I'm depressed or I'm anxious, it is useful to say, there is a part of me, there is a part inside me that feels either angry or sad or hurt or anxious or whatever that is. And just framing it in that verbiage of, there is a part of me, there is a part of me that feels, and filling the blanks already makes a difference. That it's not me, all of me, it's just that there's a part of me, or maybe like this, there's a kid in me that feels so and so. Inner representation is something that I don't have enough time to elaborate today, but usually we can create inner representations of our feeling. We can imagine our feelings in all sorts of ways. We can give them color, we can give it a shape. And sometimes when we do that, when we close our eyes and give some representation to our emotions, we can actually work with them, maybe talk to them or change their colors. Or for example, if I work with someone and I say, okay, so you feel anger, so close your eyes and imagine what color would you give it? And let's just say they say, well, it's black. I'm like, okay, so can you maybe make this black a little less dark, maybe a little lighter? And can you make it a little fluffier? Or can you maybe change the color? And a lot of time when we change our inner representation, it helps us with changing or relating different to our emotions. The last slide that I want to say, and further how to work with emotions, is I want to introduce you all to this concept that we have primary emotions, but we also have secondary emotions. And what I mean by that is that when we say primary emotions is our automatic reaction to a specific context at hand. And usually those primary emotions are healthy and adaptive, and it would be useful for us to experience that. For example, if someone did something that is unjustified or unfair, and that causes us anger. So noticing or recognizing that anger is important. Or let's say that there is a loss, or God forbid, we lost someone or something, and we feel sad. That's a normal reaction. If there is a danger, when we feel fear, when there is happiness or a party, something joyful, and we feel joy, all of those are the primary emotions that are related to the context at hand. However, that usually is not the end of the story, because all of us have what we call secondary emotions or meta emotions. And those are usually the judgments or evaluations about our primary emotions. And usually those secondary emotions are what gets most of us in trouble, because those are evaluations that a lot of time don't let us actually experience those primary emotions. So for example, let's assume that something happens and I feel afraid, and all of a sudden there is something inside me that says, oh, what do you mean you're afraid? Only weak people are afraid. You shouldn't be afraid. That's bullshit. Or let's say that I feel anger, but then there's something inside me that says, no, good people don't feel anger. I'm a good person. I should not experience this anger. That's wrong. Or let's say a case that I had in my private practice, that I was working with someone and she got emotional. And as she was crying, she was like, well, why am I crying? I'm not a little girl. All of those are judgments and evaluation that prevent us from experiencing those primary emotions. And those evaluation or judgments are usually maladaptive and cause us to be avoidant and not experience our primary emotion. And from my experience, when we block our primary emotions, usually that can cause internal stress that contributes to a lot of physical um, physical manifestations. So in the exercise today, we're going to also learn how to at least be aware of our secondary emotions or our evaluations about our primary emotions. Feeling emotions is important because recognizing our primary emotions and allowing them is a very, very helpful way to be healthy. And of course, when I say expressing emotions, is to find a healthy and safe outlet for our primary emotions. Now, of course, we're living in society, and maybe not every context that we're at is appropriate to experience every emotion. And it's also sometimes that even when we experience emotions, we cannot express our emotions in a way that hurts others. So, for example, if I'm really angry, I cannot take something and throw it on someone. That's inappropriate. So, when I'm saying healthy and safe, I'm talking about recognizing our primary emotion, verbally expressing them in ways that is healthy and not causing damage to anybody around. And if there is a context that we are not able to actually express our emotion, is to find a safe environment, whether with a close friend or a family member or a psychologist, or using our imagination to actually let those primary emotions out and acknowledge them and notice them and let them be. Journaling is the last point I'm going to make because I find that it's extremely helpful to actually have a journal, like a notebook, that we can actually write down everything that we want. And I'm writing specifically without filtering. Since this is our notebook, it's to say and write down whatever we want, even use the F word, even write down everything we want so that we can get it out of ourselves into writing. So all of those are some snippets that, of course, each and every one can be a workshop on its own, but I just wanted to give you some examples of how specifically we can work with emotions that are unresourceful. So without further ado, I want us to do an exercise that I call it the emotional awareness exercise, and I'm going to